These are sort of generally accepted national guidelines that describe how we treat patients. There are exceptions to these, of course, but most patients we treat based on these categories of curvature. So under 10 degrees of Cobb angle is normal. You can get that from just a postural lean. 10 to 20 degrees is mild scoliosis. So in some cases, mild scoliosis doesn't progress at all. So we usually recommend just monitoring these patients and not initiating any specific treatment. If you have a moderate scoliosis, which is defined as 20 to 45 degrees, or you have somebody with documented progression and they're skeletally immature, which means they have a lot of growth remaining, that's the window of treatment for a brace. And so the brace is by far the most effective non-operative treatment that we have. And then if you get above 45 or 50 degrees, that's when we start talking about surgery. And surgery is not mandatory the moment you hit 45 degrees, but that's sort of the moment that we begin that conversation. And the reason is because curves that are over 45 to 55 degrees tend to progress even later on in life and be the ones that cause problems. And then another thing to mention is physical therapy. So I mentioned brace treatment. Physical therapy, as far as we understand it, for the most part, there's not a clearly established window for when it can be useful. So we can use it at any point in the spectrum. It can be used in a patient with very mild scoliosis who's concerned about posture. We can use it in a patient that is in that bracing window to be synergistic with bracing. And we can use it after the patient's reached skeletal maturity and they're no longer indicated for a brace to help somebody better align their standing posture.